Hey, I'm Dr. Maisha, your NLP, hypnosis, and timeline therapy master practitioner and trainer, as well as your NLP coach. Now, a lot of people ask about hypnosis and what is really the nature of hypnosis. So all hypnosis is a trance-like mental state where you experience increased attention, concentration, and suggestibility. Now, we're always in a state of suggestibility, but hypnosis increases that effect. Now, it's often described as like a sleep-like state, but it's better expressed as a heightened sense of concentration, focus, suggestibility, and vivid fantasies. People in a hypnotic state often feel zoned out, they feel sleepy, they feel very relaxed, and they're in a state of this hyper awareness. Now, there are a lot of myths surrounding hypnosis, and a lot of these myths come from pop culture and come from movie culture and media culture, but hypnosis can be a very therapeutic tool and actually was originated in the hands of physicians. So let me talk about a couple of the myths that exist in hypnosis. First of all, there is the myth that there are some people who can be hypnotized and then some people who cannot be hypnotized. The truth of the matter is that anybody can be hypnotized. And that is because hypnosis is not a do to process, it's a do with process. And because it's simply a state of trance, there are various levels of hypnosis. So there is light hypnosis, medium hypnosis, and deep hypnosis. People who say, I cannot be hypnotized, may have a little bit more difficulty going into a deeper state of trance because of the analytical nature of their brain. But with practice, it is easier and easier to go into trance. Now, the second myth is that people do hypnosis to you. And that is actually a misconception as well. Hypnosis is a do-with process. That means together with a guide, a trained hypnotherapist or a trained hypnotist, you will go into trance and then with permission experience whatever the therapeutic nature of that hypnosis is, right? So a hypnotist or a hypnotherapist cannot make you do anything that you do not want to do or that is not present in the value system in which you operate. All right, so people often think, oh, the hypnotherapist is going to make me, give them my personal information or give them my account numbers or bark like a dog or any of those things. But the truth is, if it doesn't exist within your personal value system to do these things, then you will not do them. And a hypnotherapist cannot make you do anything. And furthermore, all hypnotherapists take an oath to be ethical in their use of hypnosis, especially therapeutically. All right. So that is another misconception of hypnosis. All right. Now, there are a lot of benefits to hypnosis, such as eliminating unwanted habits like smoking or overeating, helping with anxiety, with sleep, and even with specific performance anxiety related to things like public speaking or flying and things of that nature. Now, there are a few different ways that hypnosis can actually be done. So the first is there's self-hypnosis. And this is the process when the person guides themselves into a hypnotic state. And oftentimes, this is akin to going into a very deep meditation. And oftentimes this can be helpful for things like pain or anxiety and even insomnia. Now, the second type is guided hypnosis. This is when you listen to instructions, recorded instructions that lead you into a hypnotic state. Now, oftentimes, if you go to a hypnotherapist in person or live, or you do a live hypnotherapy session, the session can be recorded and used later as a guided hypnosis. And then there are also a lot of mobile apps and audios that can be used to do guided hypnosis. And then the third is the use of a licensed hypnotherapist or a hypnosis practitioner that you actually go to specifically treat conditions like PTSD or anxiety or depression or, phobias, specific phobias, even to help eliminate unwanted behaviors, eliminate specific cravings like for cigarettes or for particular foods. So why might people use hypnosis? There are a variety of reasons. People use hypnosis to treat pain. I specifically used it in childbirth. And so there are people who use hypnosis in childbirth. People use hypnosis in behavioral conditions such as ADD and ADHD to help them focus and concentrate better. Hypnosis has been shown to improve symptoms of nausea during treatments like chemotherapy and radiation in cancer patients. And hypnosis has even been used to treat pain as an anesthetic during certain dental procedures. There are all kinds of things that hypnosis can be used for, both in the realm of medical conditions as well as in the behavioral domain, such like I said earlier, weight loss, quitting smoking, and even bedwetting. So now what does hypnosis feel like? A lot of times when you're going into trance, if you can think of a time, if you can remember a time where you were sitting and maybe you were watching TV or listening to a song and you were so deep into that song that the whole world was shut out. You were just really focused on that song. So much so that maybe someone came in the room or maybe someone called your name 2 or 3 times and you didn't hear it. This is one of the aspects of hypnosis or going into trance. Or maybe you have been driving in a car before and you were so focused, maybe you were thinking about something, you were focused on your thoughts, or you were listening to music that you just got focused on the road and maybe you missed your turn, all right? Or you got so absorbed in a thought process that time seemed to lapse and you didn't even realize that you had traveled as far as you had gone, and you maybe missed the turn or almost missed the turn. Like, that's called highway hypnosis. You might have heard that term. And so there are various experiences of trance that you have in your normal and everyday life. Another sensation that people feel when they go into trance is the sensation of deep relaxation and open-mindedness. The experience of deep relaxation and open-mindedness, which allows you to visualize and have certain experiences that bring in creativity, that bring in new thought, that allow for new behavior patterns to come in. Some people in hypnosis actually notice sensory changes. So maybe the feeling of floating in the sky, or maybe tingling of the fingers and toes. Some people feel very heavy during hypnosis. The premise behind that experience is whatever that experience is when you're feeling that relaxed. It may be that you feel like you're heavy and you're just like completely relaxed on whatever chair or bed or couch that you're sitting on, right? You become deeply relaxed. Or you may become somewhat energized, where you feel like you're kind of floating and things are tingling. And again, you're hyper focused. You have a hyper awareness of what's going on around you. And then under hypnosis, some people experience a sense of detachment, like they're slightly removed from what they're experiencing. Some people actually describe it as feeling like they're observing themselves. But the most common way that people feel inside of hypnosis is a sense of deep relaxation and calm. And some people, when they wake up from hypnosis, actually have this sense that they've taken a nice long nap, feel rested and energized and ready to go. So that is the premise of hypnosis, some of the misconceptions and how it works and the way it feels. If you have a problem that you really want to get to the root cause of, maybe it's an unwanted habit, maybe you're experiencing pain, maybe you're experiencing anxiety, maybe you're experiencing a particular type of phobia, and you want to be able to get that at the root cause and eliminate it at the unconscious level, you might consider hypnosis. And you can learn more about that by booking a free mind remapping call You can do that by going to drmaisha.com/meet me or clicking on the link below.